So thanks, Dr. Newberry, for having me here today. Very excited to talk to you all about ringworm in animal shelters. So this is a brief outline of what I'm going to try to cover with you guys today. I want to talk with you about what it is. There's a lot of misconceptions in the animal sheltering world and the public at large about what ringworm is. Its importance in animal shelters, how we go about diagnosing it, treatment and management of ringworm in animal shelter populations, and finally outbreak response. So what is ringworm? Ringworm is not a worm. A lot of people still think it is. Ringworm is a fungal infection, and it's an infection of skin, hair, claw, and claws of animals caused by a species of fungi called dermatophytes. And there's actually hundreds of species of dermatophytes, but there's just a handful that we worry about in our animal populations in shelters. So a little bit about ringworm in animal shelters. Historically, animals with ringworm, that diagnosis within an animal shelter is a deadly diagnosis. And it's not because that disease is going to cause an animal to suffer and die. It's because animal shelters are terrified of this disease. And when they think they have it in their population, they panic and they respond by managing with euthanasia and sometimes go as far as depopulating their entire shelter populations. It's a very scary disease in animal shelters. Why is it so scary to them? It's perceived as being extremely contagious. People feel it's going to spread like fire through their population. And in some cases, it can be very highly contagious, but not all. And we'll talk more about that. It is a zoonotic disease. We can get it from infected animals, and that becomes a big concern in terms of adopting animals out to the community, as well as all the people working with the animals in the shelter. Infected animals are going to contaminate the environment, and a contaminated environment is a risk for our animals coming down the pipeline in the future from becoming infected themselves. These spores can survive in the environment multiple years if they're not thoroughly cleaned away or disinfected and killed. It's not necessarily easy to diagnose or to treat. We have some well-researched protocols, and we think that they're great protocols, but recognizing ringworm when it's really there and when it's worth worrying about is actually a big challenge for animal sheltering facilities. And finally, shelters, because they panic and feel that depopulation may be necessary if it spreads through the shelter because of an outbreak, that's a very debilitating event to that shelter. There become public relations problems, and there become just total disruption of shelter operations at that point. If you're shutting down, you're not moving animals out through adoptions anymore, and you're trying to, perhaps there's still animals coming in, you're trying to protect the animals coming in, but you're worrying about who's already there, who's already infected, and it just becomes this sort of spiraling, chaotic, scary event. So this is our classic ringworm suspect. This is Simon, and he was probably about a pound when he came into the shelter. He's co-infected with lice, and I don't know if you can appreciate that here. He's tiny, he didn't have a lot of muscle mass. He had a big pot belly, he probably had a lot of GI parasites. And who knows what he dealt with before he made his way into our shelter doors. And he was covered in ringworm. So when we think about risk in an animal shelter, there's the risk to an animal of becoming infected with ringworm even before they get to the shelter, but we also think about ringworm infected animals in terms of their risk to the rest of the population. So it's sort of a twofold way of using the word risk. So primarily when we're thinking about the risk to a shelter population, we're going to think about cats, at least here in Wisconsin. Cats are the ones who are going to come in infected with ringworm. Young animals, kittens, are the ones who are going to be more likely to be infected with ringworm when they come in. And this is probably the most important risk factor. There's others there that are going to play in, But adult animals with healthy, competent immune systems very rarely have true ringworm infections. And when they do, they tend to clear them more quickly. Living with other cats, it's a contagious infectious disease, that's a risk factor, that makes sense. But particularly cats who are coming from dirty or crowded situations, those are going to have an even greater risk of having ringworm infections. Stress, and when I say stress, I don't just mean like mental or emotional stress, but I mean stress affecting bodily health. So stress, concurrent illness, if they have URI, that's taxing the immune system. Things like poor nutrition or poor body conditions, where those are things that are stressing the body and make the body less able to prevent a ringworm infection from taking hold. Having external parasites is another risk factor, and they've actually found, there's been research studies that show fleas culture positive for ringworm. So fleas jumping from an infected animal to a non-infected animal can help spread that infection. And the other thing is that external parasites help contribute to trauma to the skin, and it's the micro-trauma to the skin that allows ringworm to get a little foothold in the skin in the first place. Animals who have good grooming habits and are healthy and they're grooming on a regular basis, they're going to groom off a lot of those spores before they even have a chance to get a foothold on the animal. If you have parasites, they might be scratching themselves, causing excoriations, and that's going to contribute to a ringworm infection taking hold. Lastly, research has shown that actually status of intake, whether they're coming in as a stray animal or a surrendered animal, has there's no difference between those two populations in terms of their risk to the shelter population. They're about equal in terms of their likelihood of coming in infected with ringworm. So we tend to see ringworm incidents peaking in the warmer times of the year. We actually have two peak periods here in this area. We see a peak in May and we see a peak in October. And down south where it's warmer most of the year, they don't have truly cold winters, they see a lot more ringworm in their dog populations, and there it's a greater concern. But can anyone think of another reason why we might be seeing more ringworm when we have warmer weather, besides straight up just the weather being a contributing factor?
More kittens.
Kittens, good job. Kitten season. And so we're getting more kittens. Kittens tend to have ringworm, and so we're going to have more ringworm in our shelters. Ringworm is spread from the spores that are infecting hairs or the hairs that are falling off of infected animals, and they get spread directly between individual animals, cat to cat, on fomites. So fomites can be my hands, they can be bedding materials. Fomites can be combs or brushes shared between animals, or in the environment. So some infections are started, and when I say environment, I mean shelter environment or the external environment, anything sort of the habitat the cat is enclosed in. And the incubation period is pretty long with ringworm. We say it's about a 2 to 4 week period between becoming infected and starting to see clinical disease. And so that's another thing that poses a lot of challenges to shelters trying to get a handle on managing ringworm in their populations. That's a pretty long period to wonder if an animal that you're housing already has ringworm or might have gotten it in the shelter. And so dealing with outbreaks, this is one reason so many shelters are so fearful when they feel they have an outbreak on their hands.
And this is something I'm not sure if we've talked about, but this issue with the incubation period is a really tricky thing, because when we talk about incubation period for something like parvovirus, we know that if an animal is exposed to parvovirus, and that it may be anywhere from then until 14 days later that animal will show clinical signs. So if we look at that animal now, we say, like, we can't really tell, and we can use various tests to sort of assess the likelihood that they might get parvo. With ringworm, on the other hand, from an outbreak perspective, what we're able to do is actually clinically, even though we know that incubation period is there, we look at the animal and we do really careful exam on the animal. We usually just send them on their way, and what we don't see is later on they show up with lesions. I can't tell you why, but I wanted to tell you that in this context, because a lot of people think they need to wait this 4-week period to see if the animal's going to break with ringworm, and clinically, we don't seem to see the need to do that. So that incubation period kind of comes from the books, the literature, but it hasn't been something that we've really seen in practice.
Thank you. So in terms of species of ringworm or dermatophytes that we think of as being pathogenic or a problem in our animal populations, we are going to be talking about 3 of them. We're going to be talking about Microsporum canis, Microsporum gypsum, and Trichophyton species as a big group. And I have a little star here by M. canis because this one is going to cause about 90% of the ringworm infections that you're going to find in shelter cats. Between the rest of these are a lot less common, and this is the least common of all that have been confirmed in animals in shelters. So don't worry, I'm going to tell you these things, and you're going to know more about what this means in just a couple of slides, so stick with me. But in terms of differences between the species, Microsporum canis, M. canis, is the only species that you're going to find fluorescence with when you perform a Woods exam. So an animal can be infected with these 2 species, but you're not going to find Woods positive lesions. We think about both of the Microsporum species as being contagious, being potentially spread from cat to cat in our shelter populations. We don't think about that quite so much with Trichophyton. In part it's because it's so rare, but in part it's because it's sort of something an individual animal, their immune system seems to have a problem with. So we think of the clinical disease that we do find as being an individual animal problem rather than a spreading from one animal to the next problem. Does that make sense? No? Yes? Kind of? Okay. And then in terms of their potential to cause an outbreak in a shelter. So this plays a large role in Trichophyton really not being a concern in an outbreak setting. We have never had a documented, confirmed outbreak of Trichophyton species in an animal shelter. Microsporum gypsum, it could happen. I don't know if it ever has. Dr. Newberry might know whether there's a confirmed outbreak situation, but because it's so uncommon relative to M. canis, it's just not something we worry about in an outbreak situation typically. It could be.
I've not seen an outbreak of M. gypsum,
Okay.
and I'd have to scour the literature to see if there's ever been one reported, but it's not something that we normally see.
So that leaves us with M. canis as sort of being our suspect. And so when we're dealing with outbreak situations, we're looking for evidence that there's M. canis in the population in question. And that, again, it becomes important in that we can use something called a Woods lamp to identify infected animals, and we'll talk more about that. So how are we going to find ringworm in the animals in our shelter, or the animals coming into our shelter? Seems obvious, I've got to say it. You have to go looking for it. And we recommend that you go looking for it right at intake. And you can train admitting staff in animal shelters to perform really good examinations and to learn what classic clinical disease lesions look like. And they can be a really great option for pre-screening animals before a veterinarian needs to get involved in the process. So when you're screening animals at intake, you are going to be able to identify animals who are already infected. And from that point, you're going to have a plan in place for what you do with the infected animals in your shelter. You're also going to be able to identify suspects. You may not have a home run, you may not know for sure, yes, this is ringworm, but it's awfully suspicious. And you can get a culture going on those animals, and you can get them isolated from the rest of your population to protect the rest of your population. And you can hold them until you have more definitive results from your culture. So this is the screening protocol that we recommend shelters use. This is how we do it at Dane County Humane Society. So everyone gets a really thorough screening exam right at the time of intake. If we don't find any suspicious lesions on the skin or in the fur at that point, move them along. We want them to get out the door and go home as quickly as possible. We find suspicious lesions, but they're not glowing under our woods lamp. What does that mean? I don't know, but it's suspicious. Let's culture that animal, wait for some culture results to confirm or deny that we are dealing with ringworm. Maybe we're dealing with something else altogether. Maybe it truly is ringworm. Okay, we do our woods lamp exam, we find fluorescing lesions, then we do something called a direct exam. And again, sit tight, more information's coming on that. And Dr. Newberry calls the direct exam, which is also called a trichogram, kind of a snap test for ringworm. So if you do that and you find the characteristic changes in the infected hairs, you got a positive direct exam, you know you've got an infected animal and you're done. So then you need to decide what to do with your infected animals. If on trichogram you're not sure, you didn't quite find those characteristic changes, let's culture that animal and wait out until we get some more definitive results from our culture. So what's nice about this is that you're sort of getting an animal on a pathway right from the beginning. You don't have to, I think it builds peace of mind amongst shelters because they don't have to stress about how they're moving animals through their shelter and whatnot, because we already sort of have an idea if they're suspicious right away and how to handle them differently. If they're not suspicious, just move them along. And you don't have to worry so much about what you're going to do if they pop with a positive, because you were already a little suspicious. So on your thorough visual exam, these are some examples of really classic ringworm lesions. And a ringworm lesion is not just an area with missing hair of alopecia. You're looking for evidence of inflammation underlying, and it's typically associated with alopecia. But when you have inflammation on the skin, you're also going to see things like crusting or scabs. You might see redness depending on the color of the animal, and you might see broken hairs associated with those lesions. So it might be hard to appreciate in these pictures, but these are some pretty classic lesions on a little kitten. The underlying skin has some crusting, some white thin layer of crusting there. That's telling us it's inflammatory in nature. This kitten, there's some redness associated with this lesion. The ear margins here, this is sort of the classic appearance of Trichophyton infections. It's the crusty ear margins, but it certainly could be any of the species if it's a ringworm infection, or something else altogether. I see a lot of animals actually that come in with crusty ears in the winter because they've got frostbite. Here's another sort of suspicious appearance, and then, does this look familiar to anyone? Does anyone have a cat at home with this problem? Chin acne. So what's chin acne? Chin acne is inflammation of the skin and hair follicles on their chins, right? So we know ringworm causes inflammation of the skin and hair follicles. And so sometimes chin acne is actually a ringworm infection. Not always. Sometimes chin acne is just chin acne. But when you're looking for it and you're trying to decide how suspicious a given animal is, how high their risk is to the rest of the population, this is a little bit suspicious in the context of the other information you've got. So when you're doing your visual exam, you want to look carefully at the whole animal. You want to go nose to toes through the tip of the tail. You want to look at everything. You want to lift up, look at the bottom of their feet. You want to look inside their ears. You want to look all around their face. Do they have broken whiskers? Their belly. Sometimes their armpits are really classic areas. And then in addition to that, I wanted to make this point that if you see something else on an animal causing inflammatory skin disease, skin lesions, you see something consistent with ear mites. They're very itchy. They've got ear mites. You've confirmed it. You found Demodex. They have fleas when they come in. Remember, this is a risk factor for ringworm infection because these parasites contribute to trauma and microtrauma in the skin. And microtrauma is what allows ringworm to get a foothold. So just because you find something like this, you can't say they don't also have ringworm. In fact, these things might make them more predisposed to having a ringworm infection. So after you've done your thorough visual exam, you may or may not have found suspicious lesions from your visual exam. You're going to go on, for every animal, you're going to do a woods lamp examination. Woods lamp examination is using a UV light that emits light at a certain wavelength. So it's a specific type of UV light. You can't just use any black light. And there's different models out there, and we actually don't recommend that shelters use this handheld battery-powered model. It just doesn't put out enough light to be very helpful to your examination. This one has a built-in magnifying glass. It's kind of bulky and big, but some people appreciate having that magnification there. But the one that we really like is this plug-in model. Handheld, fits in the palm of your hand, and puts out a good amount of light. So just as a quick aside, why do the cats glow? It's kind of an interesting question. What's happening is when the ringworm infects the hair follicles, they're putting out these metabolites, and as the hair grows, the metabolites are adhered to the hair, and so as the hair grows, it's adhered to the outside of the hair, and they just happen to fluoresce under a woods lamp exam, which comes in very handy. So just like with your visual exam, you want to be very systematic and thorough with your woods lamp exam. You want to look at every surface of the cat that you possibly can. If you found lesions on your visual exam, that gives you areas to focus on, but you still need to look at the whole animal and figure out if there's other areas that might not have looked lesional on your visual exam, or maybe you missed something. Or maybe there's some glowing hairs here, but they didn't have that classic inflammatory appearance because you couldn't part the hair down far enough to get to the skin or something like that. So false positives can occur because other substances will glow under your woods lamp. We call those false positives. False positive substances that we know, pretty commonly we're going to see, doxycycline suspension, one of our common URI meds. They get it all over their faces because they don't want to take their medicine. That's going to glow a bright yellow, and it tends to clump up the hairs. Terramycin eye ointment is another one. Carpet or lint fibers, they're going to look like little hairs sitting on the animal, and they're going to light up under your woods lamp. But those are not infectious lesions that we're looking for. And sometimes I found when you have a lesion that you found on visual exam with a crust, and you go in there with your woods exam, it's going to look like the crust is lighting up. But a glowing crust is not consistent with ringworm infection. You need to look for infected hairs. And when ringworm infects the hairs, it makes them brittle and more apt to break. So sometimes all you're going to see is a little stubble at the surface of the skin. You may not see a whole full-grown hair. But if you see glowing stubble, that's pretty suspicious. So true positives, things that are really going to confirm ringworm infection is present of M. canis. The color is a characteristic bright apple green color. Now, Dane County apparently is kind of strange. We occasionally see a different type of glow. It's a pale blue glow, and I believe current understanding is that's a pretty early infection. So you might have caught it really early in the process, but if you think about it as being this bright apple green color, you're going to get most of the cases that you're worried about. But we have other options. Again, if you're not sure, there are other ways to confirm or deny what you're seeing on your woods lamp exam is or is not ringworm. When you have a true positive, the entire hair shaft is going to glow from the level of the skin to the tip, however long that may be. As much of the hair that's present is going to be glowing. But it's also going to be every individual hair. If you see a bunch of hairs clumped together, that's probably something else that's glowing that's causing those hairs to stick together. Ringworm won't make hairs stick together. You can't wipe it away if it's ringworm. And that's something I do with a lot of frequency. I'll wet a little piece of gauze, I'll rub on the lesion, I'll woods lamp the gauze that I just wiped with to see if there's anything there, and then I'll re-woods the animal. And if the glow has changed because of my wiping, then probably it's not ringworm. And again, crusts may glow, but you need to peel them away. And sometimes there'll be little hair stubbles underneath those crusts. And if those hair stubbles are glowing, that's pretty suspicious for infection. Okay, so now I've got a video.
Okay, so who's going to do the exam on this fungus head? So this kitty was not identified as lesional?
He has a tag on his cage, but I don't know if it was put on because he's suspect.
So this was a big miss
When they
if
go-
somebody missed him. Because where do we see lesion? Like from across the room. Tip of the ears. And where else?
Nose.
Nose? Or is that?
I haven't looked at the nose yet. Like right here.
That looks like where you guys revolution.
So that could look
Oh,
like
it looks
quiet,
like-
right? But what's different? Why would we not call it quiet, this spot on
The
his
hairs
back?
are stubbly?
The hairs are all stubbly. And what else? They're stubbly, and what else is going on the skin there?
Flaky at the
Flaky
edges.
and crusty. He's like, oh, don't say it.
Right here. Right here.
And here's another
It looks like somebody shaved.
So that's all hair growing back. So that may have actually, we'll see if he's actually going to fluoresce, but that may have been, this may be hair regrowth. So once they get a lesion, then the hair grows back. And that's often what they look like as they're curing, is where the hair starts to grow back after there's been a big crust. He's like, oh, you guys are on to me. Okay. Yeah, you see that?
The black one on the top. Okay. 4.
And there, on his big foot. Fantastic. It's like, oh, they're on to me. But I found out. Anything on the belly?
Right here, it looks kind of patchy.
It's kind of patchy, isn't it? So we don't know about that so much. We'll see. See this right here on his huck where the hair is much shorter?
Yeah.
Oh, when you're sick, I'm sorry, and I'm holding you upside down. Okay. Where else didn't we check yet?
His face.
Yeah, and inside the ears, right?
Is that a lesion on his nose? or
So
is
that also kind of looks like hair regrowth to me. And the hair grows in sometimes a little different color when it's first coming in, until because they have guard hairs and then their undercoat. And that's actually a pretty quiet ear, right? Is this normal right here?
Check the other side.
You're all around me. So his ears are actually pretty quiet on the inside, right? But not up here. And certainly not right here, right? So that's a case where we think of inflammation as being red, right? And puffy. Since his skin isn't the same color as ours, it's not going to show up red for inflammation. It shows up gray or black. Okay. I'm gonna turn it off. So can you guys see on his ear? That's doxycycline. That's really good to know that that is not ringworm. How do I know that's not ringworm?
Can pick it off.
Okay, so we would be able to pick it off, which I'll show you. It's also the wrong color, and it's really good to know that because it's bright yellow. Okay. Now look at the hairs on his back there. He's actually a little unusual because he's got that blue-white glow, and I don't know why Dane County seems really good at getting this blue-white glow.
The green, I see that
Yeah,
hardly any.
and I saw it all the time when I was doing a study here, so I know it's true. And see how it's on the individual hairs, and no matter how much I mess it up, I'm not going to wipe it off. Let's see that one on his shoulder. So see how he's got, a lot of the hairs aren't glowing anymore.
But some of them are.
But he's got some stubbly stuff that are. He may have self-cured in that spot, but he's not self-curing in the other place.
It's really interesting how sporadic it is in there.
And then if you look at his ear, you're going to see he's got the same blue-white glow on his ear. See? And what he's showing us is it's each individual hair that's glowing, which is totally different than this, right? Which is like a big glob of gunk that's glowing. That's all Mr. Doxycycline face.
I found that Marquis glows too.
That's great to know, Beth. I haven't looked for that. But so he's a tricky one because he's got fake glow and real glow. So why don't you guys get gloves on? I want you all to like have your personal experience with him. And he's a good one too for here because he's got that weird blue-white glow. Normally the glow that you would see would be somewhere in between that kind of blue-white glow and that like fluorescent doxycycline glow. So the normal ringworm glow is like apple green, so it's a greener than that doxycycline. And it'll be bright like that, but for whatever reason we definitely would see that blue-white, and I saw it all the time when I was doing my studies here, so it's a good thing to get used to.
The other thing is that some cats, I found that you have to make sure you look at the whole cat, because sometimes the ears won't fluoresce,
Yeah.
but the other one on the back will.
So some of the other things when you're doing a woods exam, it's really good to have another person there to help hold so that you can focus on driving your woods lamp. And you want to be in a very dark room. And you're going to read in some places, if you ever go reading about ringworm, that you need to give the woods lamp time to warm up. And I think we've actually shown you don't need to do that anymore. What you do need to do, though, is give your eyes time to adjust to the dark, because that's going to enhance your ability to find a lesion when it's present. Okay, so next, you think you have a lesion, or maybe it's not woods positive, but there's a very suspicious lesion there. The next step, our SNAP test for ringworm, is to perform a direct examination of the suspicious hairs. And so maybe you're doing your woods lamp exam and you're like, I know doxycycline glows, but I don't know if this is doxycycline or ringworm. Pluck the hairs that you're concerned about and put them on a slide. We typically put them in mineral oil. There's some other substances you can put them in that'll dissolve a little bit more of the hair material, but we use mineral oil at Dane County for the most part. You can also use tape if you want. I haven't had a lot of luck with that, but sometimes the hairs are so brittle they'll just come off with tape. Put that under the scope, and you're probably going to have a bunch of little hairs in your slide, so you can use the woods lamp to decide where to focus your attention on that slide. If it's still lighting up, you're going to drive your microscope until you get to the hair that's lighting up, and you're going to look for these very characteristic changes. So these hairs here are normal, and it's worth practicing and looking at normal hairs before you start looking for ringworm, because sometimes they look really strange. So they have these little cells with pigment in them. They have pretty distinct walls on the outside. When the ringworm gets in to infect the hairs, what I often find is it just looks like the structure is totally obliterated. If you zoom in close enough, you might be able to see little spores infecting the hair, and occasionally you can even see little fungal hyphae weaving in and out through the hair structure. These hairs are very easily broken. And you just can't make out that normal hair structure anymore. The pigment cells are just gone. And all you see are these little tiny dots that are just filling up the whole hair. So maybe you've got a woods negative lesion, you're not really sure about your trichogram, didn't really see those characteristic changes in the hairs that you plucked. So you've got a suspicious animal, let's run a culture. And we call this our gold standard for diagnosing ringworm. And we think of our culture as being sensitive but not specific. Has anyone in here had epi yet? So does anyone want to volunteer what that means in terms of trusting positive versus negative results? So we're
sensitive means you'll pick it up if it's there most likely.
right.
So you won't have any false negatives.
Good.
But
You might be at an increased risk for false positives,
yes,
right? And so what we call our false positive cats in the context of ringworm, we call them dust mop carriers. So there's no such thing as a true carrier state. A carrier state is an animal who's got the infection but doesn't show clinical disease. That doesn't exist in ringworm. You're never going to find ringworm on an animal that doesn't have spores on its coat. You might find spores on an animal who's not infected, though. Those cats are mechanical carriers. We call them dust mop cats. They're carrying spores in their coat, but those spores haven't actually lodged themselves in the skin yet and infected the animal. So most likely those dust mop cats just need to have a good grooming session, and they're going to get those spores off their coat and never look back and never have a concern with ringworm. So cultures can grow ringworm if you grab some of those spores from the dust mop cats, and that's why after you perform a culture, if you get a positive culture result out of that, you always need to go back and take another look at that animal, do another visual and a woods lamp examination. And again, when you're screening at intake, cultures are great in suspicious animals with non-fluorescing lesions, negative trichograms. The culture results are going to tell you if you're dealing with ringworm or not, or if you need to worry about being suspicious for ringworm. And we hold those culture plates for 21 days, but research has shown that if ringworm is going to grow, it's going to grow within 10 days of inoculating it on the culture. And that's when you're growing it under the right conditions, and I'll talk briefly about that. But even, I think it's 5 to 7 days, most of them are gonna start to grow. You may not be able to identify it right away, but you might start to see suspicious growth within 5 to 7 days. So we use a agar media called dermatophyte test media, and it contains substances that inhibit bacterial growth and a color change indicator that's going to grow in the presence of our pathogenic species of ringworm. You need to keep the culture plates warm to get the most efficient growth of ringworm on your culture plate. I think we say 75 to 80 degrees Fahrenheit. Keeping them in the dark doesn't matter. A lot of people think that, but exposure to light isn't that important. It's keeping them warm that's really important. And when you're inoculating it, I didn't point that out, we grab our sample by brushing a clean toothbrush all over the surface of an animal. And what you do is you brush that toothbrush along every possible surface of that cat. If they have lesions, you go to those areas last and you brush them really thoroughly. And so then you inoculate your media by pressing it into the media, and we like to use the spiral pattern. You're going to make little indentations in the media, but you're not going to push all the way through it. And a lot of veterinarians use these slant jar versions. We actually prefer the Petri dish styles, and one reason that is, as you can see, they're inoculating here with a toothbrush. That looks kind of tough. Some toothbrushes might not even fit into the slant jars. And then this is your surface that you're looking at. And if you happen to have suspicious growth, to go back in there and try to sample it to identify it, it's going to be really hard. So we do recommend that, particularly in shelter settings, but just about in any context. The slant jar is not the way to go. We like these Petri dish style plates. So what does it mean to have a positive culture? So all of our pathogenic species of ringworm are going to turn the media red as they grow. However, other things can turn it red too. So not everything that turns it red is going to be ringworm, but all ringworm will turn it red. So the phrase that Dr. Moriello and Dr. Newberry like to use is, red means look at me. It's one way of sort of, if you have a bunch of culture plates that you're having to sort through, if you see red color change, that means take a closer look at this. This might be ringworm. But red is not sufficient to say this animal has ringworm, and that's a really common mistake that we encounter. A lot of people end up calling Dane County for advice, and there's a lot of ringworm being diagnosed on the basis of this color change, and that's just not going quite far enough. Ringworm will grow in with a very characteristic appearance, both in terms of its morphology and the color and the ways that it grows on the plate, and I'll talk about that in a little bit. And so if you get to the point where you find a plate with red color change, it looks consistent with ringworm based on its appearance. The final step that you must do is identify the type of ringworm or fungus that's there. It still might not be ringworm, but you need to try to identify it. And remember, the reason that we want to identify, because if it is ringworm, it makes a difference which type of ringworm we're growing, right? If you have Trichophyton there, your reaction is probably going to be quite a bit different than if it's Microscopic canis. Things to remember about characteristic appearance of ringworm on our plates. It's never going to be darkly pigmented. We say it's always white. Sometimes it looks kind of buttery or tan in color, but keep white in your head. You're always going to see red color change associated with the areas where the colonies are growing. And it has a certain characteristic morphology. And so this is the one I want you to keep in your head. I'm going to talk about this briefly, but this is what we're really looking for. You can see it's white. It's got sort of a feathery appearance or a stellate or star-like appearance. And it doesn't have a 3D presence on the plate. It doesn't grow up and get cottony and fluffy. It stays really close to the surface of the media. And this is what our microsporum species look like as they're growing. This is sort of the more classic appearance of trichophytons, and it's a little bit different, which is the reason I included it here. It's more condensed, white, sort of powdery looking. So again, the most important point here is to get to the point of saying, red color change, yes or no? Yes, okay. Does it look like it could be ringworm? Is it white? Even if that's as far as you get, At that point, you can always use your microscope to get you to the final part of recognizing whether you have ringworm or not. So you don't necessarily need to, at this point, worry about figuring out if you're looking from a distance at Trichophyton versus Microsporum. Just sort of say, is it white? Does this look suspicious? Do I need to do a tape prep? So this is a view through the auger of that morphology that we're looking for in our Microsporum species, and I think it highlights really nicely the little finger projections that it puts out as it grows. So this is time for group participation. So in this side, we're looking through the auger, the lid's on the bottom, and this is how we recommend you store them. The auger's on the top. And so this is going to help you determine if there's red color change there. And the lid is off, the auger's sitting against the desk surface now, so you're looking at the surface of the auger. So we've got this big colony growing right here. This is that same colony here. Is it ringworm? What do you guys think? So someone who's saying no, tell me why it's not ringworm. It's not white, it's got pigment. Very good. Does anyone disagree? Okay, good, it's not ringworm. So you don't have to do a tape prep on this. You've gotten far enough to say, this isn't ringworm, I'm done. This is a negative culture, assuming you've incubated under the right conditions for long enough. Is it ringworm? So everyone I see is nodding. So one of the people nodding, tell me why you think it's ringworm.
It might be ringworm.
It might be ringworm. Okay, that's a good answer.
It's white and the media turned red, but you should look at it under a microscope.
Yep. And this is a very classic appearance. So if you do this enough, you're gonna go to your incubator, you're gonna pull this out, and you're gonna say, whoa, this is ringworm. We still want you to do the tape prep at that point, because it might be on gypsum, it might be on canis. And that's important to know, but basically you know you've got an animal that you've gotten ringworm spores off of at this point. Is this ringworm? So this one's a little bit trickier, right? We've got this big colony here, which is also over here. We've got a white guy over here, and he's actually on this side of the plate. I think it's right there. And then we've got some of these little green guys sporadically. So do you think any of these are suspicious for ringworm? I think I see a couple people shaking their heads. So anyone want to volunteer why they think it's not ringworm? So pigmented, right? Pigmented, pigmented, pigmented. This one's white, it's brown. Ringworm, yes or no? So color change, not super compelling. Probably not ringworm. But if the animal had a lot of lesions and you're just not sure, go ahead and do a tape prep. Figure it out. But probably not. Probably not ringworm. So then when we're looking at these cultures to sort of, you remember the dust mop carriers, they have ringworm spores in their coat at the time we cultured them, but they're not actually infected. They're not posing a risk to the other animals in our population. So we use P-scores for our cultures that we're incubating to sort of determine the likelihood of true infection versus dust mop carrier cats. So we assign it in 3 different categories, pathogen scores. P1, we see 1 to 4 colonies on the plate. P2 is 5 to 9, P3 is 10 or more. So what would be the P-score on this plate over here? Two. Good job. What would be the P-score on this one? P3? P-score? So all these little lumpy bumps are ringworm. So this is P3, but we call it a swarm. It just covers the whole plate. You can't even make out individual colonies anymore, but it's a P3. I just want to point out briefly, this one might be a little bit confusing based on what I've already told you. You're not seeing the red color change there. This is a post-treatment culture, and post-treatment cultures end up looking a little bit weird. But that's okay, because if you're doing post-treatment cultures, you've already confirmed the animal is truly infected with ringworm, so you know in your post-treatment cultures you're dealing with ringworm at that point. And we'll be talking more about that later. So in terms of risk, P1s and P2s could be dust mop carriers, could be true infections. P3s, if you've got a P3 plate, that animal's got ringworm infection. And certainly there are times when you might have an exception to that, but if you run with this as a rule and you decide to act on this being your response to an individual animal in your shelter, you're going to be on good footing. And the time when this might become important is if you're working with a shelter who doesn't have the ability to treat ringworm infected animals. If euthanasia is the outcome for an animal with a true infection, that might be a time where you're going to be a little bit more careful before calling that a true infection based just on the P3 score. So again, it's going to be important after you get your culture results to go back and look at those individual animals to see, okay, now are there lesions if there weren't before, or are the lesions changed? Are there more of them? Or now can I find a Woods positive lesion on that animal if you're dealing with MKs? Okay, so we run our cultures on our suspicious animals and we get a positive culture. Again, the important thing here is that you always say, what is it positive for? It's always important to go in, do your tape talk about that in a minute, to identify the species of ringworm that's growing on your culture plate if you think there's ringworm there. Particularly in the cases of outbreak situations, because remember, this is scary, this is debilitating. We want to know if we really do have an outbreak on our hands, or maybe we don't, and the shelter's just feeling really afraid and stressed right now. If you can diffuse that by telling them that this ringworm growing on the culture isn't M. canis, or it's not even ringworm, that's going to be really helpful. So remember, a positive culture, when you're calling something a positive culture, you're looking for red color change, the characteristic colony appearance, you're going to assign a P score, and you're going to identify the ringworm species that's growing there. And for those of you who haven't had bacteriology yet, this is something you'll learn in lab. I'm not going to spend a lot of time on it, but this is how I go about identifying what species of ringworm is present. You use a special dye. We use lactol cotton phenol blue, lactophenol cotton blue. You can also use new methylene blue. And you stick a little piece of tape. It's sticking to the fingers on either end. The sticky side is down, and you tap that against the colonies that you want to identify. And then you throw that on top of the dye, on top of a microscope slide, and you're good to go. Dr. Moriello, her little hint with this is the longer you let it sit in the dye, the more vividly the characteristic structures are going to light up. So if you're not sure right away when you're looking at it, give it a little time and go back to it. So these are our microsporum species. This is what they look like under a microscope. I apologize if I'm blocking review. They look very similar, and these structures, these canoe or boat structures that you see are called macroconidia. And there's pretty subtle differences between them. Often, not necessarily always, I'm going to see a lot more macroconidia on an M. gypsum culture compared to a Microsporum canis. So that's one clue that I'm dealing with gypsum versus canis. And also you can sort of hopefully appreciate that the edges are a little bit more rounded, the walls aren't quite as thick. Some people describe this tip of M. canis as having a little knob. And some texts that you read are going to talk about the number of cells inside the macroconidia, but I don't think that's actually terribly reliable, so it's not probably worth going to that level. Trichophyton looks like this. You're going to look for spiral hyphae, microconidia, and these little cigar-shaped structures at the end of the hyphae. And trichophytons are actually really hard to identify because they often just look like fungus. But if you can say it's not microsporum, you've come a long way. So that's really important. And it takes practice. So day 5, it's an early culture, you've got suspicious growth, but you really want to know if the animal's culturing positive for ringworm. What do you guys think? Is there a ringworm growing here? Maybe, maybe not. I don't see any macroconidia. So you put it back in the incubator, you come back 5 days later, you give it a 10-day culture. Now what do you think? Definitely got ringworm now. And based on the number that I'm seeing here, just looking from a distance, I would probably guess, just based on this gypsum. But I'd go in and look a little bit closer. And go back to the animal and see if they fluoresce when I examine them. So you're a shelter vet, you're working in the shelter, and one of the care staff comes running up to you carrying this kitten and says, "This kitten has a positive culture." What do you do with the kitten? So we don't have a lot of information, right? If you didn't call it a positive culture, you don't know if anybody looked at it under a microscope to identify the species that was there. So again, what I'm trying to say here is always go through all of those steps. Always say positive for what when you're calling an animal positive. Okay, so I'm running way behind, so I'm going to try to prioritize. I'm going to try to pick up the pace. If things get really confusing, just slow me down if you need to. All right, so here we're working in the shelter. Carrier full of kittens comes through the door, barn kittens. They're being surrendered as strays. How do we identify what kind of risk these particular kittens are posing to our shelter population? We're going to screen them in intake, right? They don't have lesions. Get them out the door as quickly as possible. If we find suspicious lesions, but they're not glowing, we'll take a culture, make them wait until we get culture results, but in the meantime, they've been labeled as suspects and business can be carried on as usual. If we find something suspicious under our woods lamp, we'll go ahead and do our trichogram. And from there, we can decide whether we need to do a culture at that point or decide that these animals are truly infected and we're done and we need to determine what we're going to do with them at that point. So if we say they've got ringworm because they have characteristic lesions on visual exam, they are fluorescing under our woods lamp, we found a positive trichogram. Now what are we going to do about it? So something I haven't told you is that healthy animals living in a clean environment are going to clear their own infections, eventually. But on average, that takes about 4 months. So, good idea, bad idea. So it seems like that might not take as many resources, right, as treating. But if you're going to hold them that long, those kittens are going to get bigger. They're not going to be quite as appealing to adopters, potentially. You're putting in resources in holding them, feeding them, caring for them on a daily basis. And they're shedding their spores into the environment and potentially causing risks of zoonotic transmission to the people caring for them or those spores being passed along to other animals and causing new infections. So we advocate treating when possible. Not every shelter is going to be able to treat for ringworm or manage it in-house, but we think a lot of them can and do it safely without posing risks to their populations. And we think of ringworm treatment as sort of having 3 pillars of treatment. The first pillar that we think about is isolation. Move them somewhere where they're not going to pose a risk to the rest of our animals. So at Dane County Humane Society, we have a separate building. This is called our FIT Center, Felines in Treatment Center. It's totally detached from the building. And within that, we have different zones of relative contaminated areas. This was the old treatment facility that we had, and what I wanted to show you here, it's not showing up very well, but we have this red tape here, demarcating contaminated zone, not contaminated zone. And so this helps manage people's way of approaching when they're caring for these animals. We have everyone wear gloves and gowns so they're not contaminating themselves, not putting themselves at risk, and also when they take those things off, they're not contaminated and spreading those spores to other animals. So then the second pillar is treating the animal who's infected, and we think of treatment as being kind of a sandwich. We treat from the inside out and from the outside in. For outside-in treatment, we recommend lime sulfur solution, and we recommend using it at 8 ounces per gallon. If you read the label, it's going to tell you to use 4 ounces per gallon, and research has shown that that is not as effective as using it at this concentration. So this is the concentration we're advocating that people use when they're treating ringworm. You're going to do that twice a week until we can declare the animals cured. The inside-out treatment is oral itraconazole. We do that once a day for 21 days and then stop. And in terms of monitoring response to treatment, we're going to culture them just before we dip them again. And we're going to do it once per week. And we're going to monitor the results of those treatment cultures to decide how they're responding. So P-score becomes very valuable when you're looking at treatment cultures, because we hope that as they're responding to treatment, their P-scores drop and eventually they start having negative cultures. And we define a cure based on negative cultures. So they need to have 2 negative cultures 2 weeks in a row, taken at 1 week intervals. So they need to be the same 2 weeks in a row, smooshed together with the negative cultures. And so we hold treatment cultures for 21 days. And so the first one, it's going to be the 3rd week of holding it. It's still going to be negative. And the second one, it's going to be the 2nd week where it's still negative. And we hold them for 21 days, particularly in the case of treatment cultures, because when you start treatment, the ringworm gets wimpy, and it might take a little bit longer to grow. And so we need to hold them that long to really, truly call the culture negative. Go ahead.
So if you had you did your first treatment after and you had a negative culture, and the next time you did the culture, you got P1, so there was 2 colonies, would you consider that not effective and you would have to restart the treatment? You would administer the treatment again, or does it kind of depend on how many colonies you see? Do you consider it negative?
So you're saying 1 week you got a negative.
Yeah, you got no colonies, and the next week
But then
you got
suddenly they
2.
culture positive,
Yeah.
is what you're saying. So I'll come to that a little bit later, but it can happen. And so they just aren't on the course to curing. So they get started back at 0, not in terms of what we're doing to treat them necessarily, but in terms of how close they are to graduating, because we have to have 2 weeks in a row where they're negative and confirm negative. Other things can come into play to contribute to a positive culture, and I'll touch on that in just a minute here. So lime sulfur solution. Has anyone worked with it, smelled it, seen it? It smells bad. It smells like rotten eggs. A lot of people really hate it. And a lot of people don't want to use it. Okay. But it is the, I'll just say it like this. Nothing else has been proven equally as effective to date, and so we do recommend that this is what people use. When you're dipping, you don't dip the cat in a bucket of lime sulfur solution. That's really stressful and mean. Don't do it like this. And always when you're working with ringworm suspects or animals that you just don't know, wear gloves. When you're dipping this, sorry this is a little blurry, we recommend that people use these garden sprayers, and it's nice for the cats to have something to hold on to, and you soak them down to the level of the skin in the lime sulfur solution. And when it comes to the face area, you can wet a washcloth and wipe it around their eyes and their mouth, but you want to make sure you coat every surface of that cat so that every inch of that cat is inhibiting and killing ringworm spores in the cat. And so the other beautiful thing about ringworm is not only are you treating the cat, but you're decreasing environmental contamination from that cat because you're killing all the spores that are there. And that's one of the reasons it's so effective in the shelter environment. I'm just going to take a couple minutes here. So if you're getting unexpected culture results, you get a negative and then suddenly they're popping positive, go back and re-woods them. But also you need to look at your sanitation practices because it's possible the environment's contaminated and they're getting spores from the environment back on their coats, and those are false positive culture results. Environmental decontamination is really important, and I'm happy to talk to you all about that if you want. But in the meantime, thank you for listening, and please let me know if you have any questions at this point.